Hi everybody, welcome to Healthline. I am Gregory Zarian. So it is November, and for men, it is the month of us and our health, which is now known as Movember. The entire month is dedicated to us talking about our health, prostate cancer, all types of cancer, obesity, working out. We spent a lot of time talking about women because women are a lot more open about how they're feeling, what's going on, and it's just more of a conversation. More men have become sick and unfortunately passed away because of their lack of conversation. So one of our missions here at Healthline is to give you as much information as we can so you continue the conversation. So happy Movember, guys. This is all about you, and this is also for all of you that are watching to pass on signs and symptoms. Today we're specifically talking about prostate cancer, signs and symptoms, health and wellness, and I'm bringing back one of our favorites, urologist Nguyen from Adventist Health Glendale. How are you, doctor?
I'm fine. How you doing, Greg?
Have you missed me?
Gosh, it's only been 3 years since this pandemic hit us, right? We've been, self-isolated from everyone.
We have, but we're here to talk about it.
I'm glad that we're able to become hopefully normal again and spend time with our families and our friends and be out there in the public again. Absolutely.
Also, making sure that we wash our hands, take care of each other, and if a place you go into says, please wear a mask, because we're in this together. It's not separated or isolated. We are all in this together, and I feel that we will come out of it stronger, taking care of ourselves and taking care of each other.
I agree with you 100%. This all requires teamwork. All of us have to work together.
So here's to us together as a team, giving you guys information that you need to know. How much do you love the fact that November is dedicated to men and the conversation about their health, Movember?
Well, I'm so happy that we have time to dedicate a segment, to men's health, because I believe from our last time that we talked, I specifically mentioned that us men, we're the ego, the one who try to keep us things to ourselves instead of talk about our prostate during beer time or at the bar. So I'm glad that I'm able to speak with you today and revisit the conversation.
And we're going to talk about new signs. We're going to talk about new statistics, which are staggering to me. And we're also going to share with you what you need to know, signs and symptoms, and how to keep you and your prostate healthy. More Dr. Nguyen when we come back. Don't go away. Welcome back. Did you know that according to the American Cancer Society, the number of newly diagnosed prostate cancer patients has increased by nearly 30% since 2022, and that estimates that there will be over 34,000 estimated prostate cancer-related deaths this year in 2021. The National Comprehensive Cancer Network, NCC, recommends anyone with a family history of certain cancers or patients with prostate cancer should know their BRCA status. Joining us from Adventist Health is one of our favorites, Dr. Nguyen. Doctor, why have we dropped? Because the last time you were here 3 years ago, pre-COVID, men were doing so much better. What's happened?
Well, several years ago, and I would probably say about, according to my recollection, maybe about 6-7 years ago, the United States Preventive Task Force made the recommendation not to have men screen for PSA. Prior to that, PSA was really recommended, and at that time, many men were tested for PSA.
And when you say PSA, can you break that down for us?
PSA stands for Prostatic Specific Antigen. It is a biochemical markers that tell us about the health of the prostate. It doesn't tell us whether or not there's prostate cancer present, but it tells us that there's something's going on with the prostate.
Is that through urine or through blood?
That's through blood. Okay, so like I said before, before the publishing of the guideline by the United States Preventive Health Task Force, PSA was recommended. So a lot of men were getting out there, getting their PSA, and as a result, there were a lot of newly diagnosed prostate cancer that were found, and treatment for that. And so as a result, the number of mortality and morbidity decreases. Then the guideline came out, and PSA screening or testing then drops. And I think from that, we then saw an increase in the number of cases of prostate cancer. And probably due to this, they revised their guideline. So they now recommend that we should talk and discuss with men, high-risk men about the age of 40, and in regular patients, regular men about the age of 55, and talk about the implication of PSA, what does that mean, and to make a shared decision to get PSA testing for prostate cancer.
So on one hand, they went, uh-oh, we've got to do something different. And then on another hand, you as a doctor with your patient are bringing them into the conversation. So it's more of a conversation between patient and doctor.
Correct.
Which is actually great, because then, one thing that we addressed a little bit in the beginning is ego, and a lot of men are afraid to talk about signs and symptoms and what's going on. So how great that you as a doctor are inviting this conversation, because we should never be afraid to talk about what's working, what's not working, how we're feeling, signs and symptoms, so on and so forth.
Correct. I mean, for me, my style of practice has always been to, number one, get patient proactive in their decision making. If I'm able to give them a choice, and I'm sure that a lot of my patients out there who come to see me know that and I tell them that if I'm able to give you a choice in terms of what care you can receive, I would like to do that. But there are certain disease that there's no choice, and I tell them, okay, this is what we have to do.
I love that. In the statistic, doctor, it said know their BRAC status. What is BRAC?
It's a BRCA2 genes.
Okay.
It is a gene that's been found to be prevalent in patients with breast cancer.
So they're connected?
They're connected, yes. Breast cancer, colon cancer,
wow. Okay.
prostate cancer. So it's so now the recommendation, I think that the trend will be that we do now recommend genetic testing for those patients whose family member have metastatic or highly aggressive cancer, or in those, for example, with what we call the Lynch syndrome. That's one of the syndrome where there's a family history of, for example, ovarian cancer, upper urinary genital cancer. So that's what we're looking at.
So if my father had prostate cancer, so then are you suggesting that my brothers and I should go get checked for the BRAC?
If he has advanced metastatic cancer, then yes, I would recommend that. But actually, in your family, from our last conversation several years ago.
My father had prostate cancer. My older brother had bladder cancer, which I was checked for.
Yeah, so I think
my mother
that
had esophageal cancer.
Yeah, I think that you are certainly should look into that.
Okay.
Genetic testing.
So then, for anybody that is watching, if there is specifically family history in your family in regards to ovarian, lung, prostate, all of them, talk to your doctor about getting tested genetically.
Right.
Because you want to be ahead of everything.
Correct.
Doctor, what is prostate cancer?
Well, prostate cancer is a malignancy of the prostate, obviously. The most common type is what we call adenocarcinoma, where the glandular component became abnormal. Prostate cancer is usually diagnosed pretty much now through a routine PSA testing, where the PSA is found to be elevated. And then it is confirmed by a prostate biopsy, whereas the biopsy is done in the office. It will take us about 15 to 30 minutes to do a prostate biopsy through ultrasound guidance. So that's what prostate cancer is.
And also, can you check for prostate cancer through a urinalysis as well?
Pretty much you cannot check for prostate cancer through a urine analysis, but you can have a test either called MDX Select, which is one of the urine tests that can tell us the risk of having prostate cancer. but it doesn't tell us whether or not you have prostate cancer or not. And also can tell us about the risk of having aggressive prostate cancer.
More Dr. Nguyen when we come back. Don't go away. Welcome back. Joining us from Adventist Health Glendale is Dr. Andrew Nguyen, urologist. So doctor, you, before we went to break, you talked about doing a blood test. We addressed a urine sample to check to see if prostate cancer is detectable. But then here's one thing that I know a lot of men are afraid of and apprehensive of, is actually having their prostate probed by their urologist. And in the past, I've said, you know, a finger can actually save your life. What do you say to the man that is so afraid of having their prostate checked with the finger? What can you say to them?
Sure. I'm going to tell you this. I think that a digital rectal examination should be part of the physical examination because it, number one, can tell us the size of the prostate. Also, it can tell us whether or not there's any abnormality, like an induration, that give us, you know, an idea of, you know, whether or not there's prostate cancer present. I'm going to tell you this as well. You know, I'm a urologist. Okay, I do this for a living. I see patients. I check for their prostate day in and day out. I don't even like to have the prostate exam for me, but I tell my patient, listen, I have my prostate check as well. So if I can do it, you can do it.
It's 5 to 10 seconds of awkward.
Correct.
You know, my doctor's been here, Dr. Kamyar Ibrahimi, and seriously, he's like, listen, it's time. And I look at him and I go, just tell me you love me and we're great. And I love it because here's the thing, it's in my family history. And as awkward as it is, I go in there knowing that I am being preventative and I am taking care of myself. So for anybody that has the withholding of, hey, dude, I'm not going to do it, it can save your life. So do it. And if Dr. Nguyen does it, you have no reason not to do it. Doctor, can you share with us what are the signs and symptoms of prostate cancer?
Well, prostate cancer is really a silent killer. Most of the time they are asymptomatic. And we usually pick up prostate cancer like through a digital rectal examination and a PSA test. So that is the most common way.
I have here some of the signs and symptoms that you could possibly find would be frequent urinating, trouble urinating, pain and burning, blood in the urine, a painful ejaculation, and then a few places it says dull pain in the lower back and also dull pain in the lower pelvic area. Is that early onset? Is that more advanced?
Pretty much when we see those signs that you're talking about, they can be intertwined with BPH as well.
Okay. Well, then what is BPH?
Which is benign prostatic hyperplasia, which is one of the most common disease in men.
Interesting.
So when we see that, we have to distinguish, is it BPH or is it sign and symptom of prostate cancer?
And what is the distinction?
Pretty much, there can be no distinction.
Interesting.
To be honest with you, when patients start having back pain, or bone pain, pretty much that's kind of advanced disease because it could tell us that you may have prostate cancer that may goes to the bone.
Wow.
Or is blocking your kidneys.
Okay. But if someone has blood in the urine, if someone has trouble maintaining or keeping an erection or ejaculation, they shouldn't just have a one-off and go, oh, they actually need to call their doctor and say, hey, this is what's happening.
Yeah, I agree with you. I think that anytime we see patient with blood in the urine, this is something that should be taken very seriously, especially if they have what we call gross hematuria, which is blood that you can see with your own eyes.
Okay.
This is an urgent matter, and you should see your primary care and get tested for an infection, get tested for prostate disease, and get tested for even kidney issue, like kidney stones or kidney cancer. So these are the things I think that men should look for, when they're having symptoms, that they should not brush it aside. And they should really need to see their doctors.
And one thing too that I want to go back and celebrate women for is women are very communicative amongst their relatives and also their friends. They will have an open conversation about, I found this, I found that. And men, as we were saying earlier, necessarily won't be out with the boys and say, hey, you know what? I found blood in my urine. So what we've talked about here is really be open with your partner, your spouse, your significant other, and really have a conversation, because they may know something, and you're not going through this alone, but you also want to have somebody with you, and also maybe find a friend that you can actually be very open with, because it may be scary to say it the first time. However, the conversation can open up to so much more and can possibly save your life.
Yeah. I think the most important person is really your partner.
Sure.
Your wife or your girlfriend or your significant other is the one that usually bring you to see the doctor.
Sure.
And I've seen that many times. So, and I've actually seen patients where the family member washed their clothes and they see blood stain in the underwear. And that was brought to the attention of the doctors. So yes, I think the most important thing is, number one, let your partner or your spouse know any changes in terms of your urination or blood in the urine. And feel free to discuss it with them, because who's going to be there to take care of you except your spouse or your partner at the end of the day?
And here's the thing, if you do not have a spouse or a partner, talk to a sibling, talk to your best friend. It can possibly save your life more. Dr. Nguyen, when we come back, don't go away. Welcome back. Joining us from Adventist Health Glendale is urologist Dr. Andrew Nguyen. Doctor, somebody's diagnosed with prostate cancer. What are the treatments?
Well, it depends, number one, on the stage of the prostate cancer.
So it's stage 1, 2, 3, and
correct.
4. Okay.
And also depends on the type of prostate cancer and what we call is their Gleason score, that tell us about the aggressiveness of the prostate cancer. There are several options, and for me, active surveillance, where we watch the cancer by monitoring their PSA and doing a repeat biopsy about a year and a half later, is a great option.
Sure.
For patients with low risk disease, because most men will most likely die from other things rather than from the prostate cancer. If patients want to be treated, we have surgery, which can be done open or robotic, and I'm sure a lot of my colleagues will agree with me, even though there's a trend toward robotic, that the most important person that you need to when you do your research about a surgeon who is going to operate on you, I think the most important thing is experience. Because studies have shown that in hands that have done a lot of, whether it's robotic or open, the cure rate is about the same.
And doctor, that's the Da Vinci method.
Correct.
So somebody comes into the hospital, they have a prostate surgical procedure. What is recovery like for them?
Usually they will have a catheter anywhere from 5 to 7 days.
Okay.
They can have incontinence, which can be as short, hopefully, as about 4 to 6 weeks, but it can last up to a year.
Okay.
There's a potential for erectile dysfunction, of course, which is the most feared complication of surgery, whether or not you have the Da Vinci or the open. They cannot lift anything heavy for about 6 to 8 weeks. Pretty much, that's what the progression of the recovery is like.
What is your advice to all of us men? How do we maintain a healthy prostate?
Well, number one, I think the most important thing is, number one, exercise. Number two, lose weight. Number three, eat a low-fatty diet. Don't smoke. And
Say that one again.
Don't smoke.
For you that smoke, put your cigarettes down. Stop it.
Okay, and be proactive about your medical care.
I love that. And same thing with alcohol and drugs, like say no to drugs, and as far as drinking, do it in moderation. And also, if you find something that may be a little bit off, don't Google, because you're not doctors, don't self-diagnose. Just pick up the phone and call your doctor and make. And what's so great now about everything that's gone on with COVID is you can have a teleconference with your doctor.
Correct.
We spend a lot of time talking about men in urology. Can you talk about women in urology?
Well, I'm glad that you mentioned one of my favorite topic, which is something that a lot of women don't realize, that there is treatment for incontinence. That is the number one.
That is fantastic.
Morbidity for women. I have patients who come in to see me for loss of urine leading to urinary tract infection, skin breakdown. Especially in elderly women, they can trip and fall. And I don't think they realize that we can do something, whether or not a minimally invasive procedure such as a bulking agent or a 1-hour surgery.
What do women need to look for in regards to signs and symptoms so they can actually then come and see you?
I think that if the female patient are losing urine when they cough, sneeze, or when they have no control, they should really talk to their primary care doctor and have a referral, whether or not to see me, who is a specialist in female urology and reconstruction, or to one of the gynecologists whom I work with to perform concomitant surgery.
I love that. So ladies, if you are experiencing anything of what Dr. Nguyen said, please make an appointment now. In regards to total men's health, since it is Movember, and Movember's motto is to grow a mustache, to engage in the conversation, what do you want to say to us guys about being as healthy as we possibly can be?
I think I cannot stress more and anything else more important than please exercise.
What is
eat
that?
Healthy.
When you say exercise, what are we looking at?
It could be as simple as walking 2 or 3 miles per day.
Love that.
Okay. Again, eat healthy, lose weight, stop smoking, and most importantly, like I said to you, be proactive in your medical care.
Will you come back again? Because and you promise you won't wait 3 years this time?
Thank you very much. I would love to be back again.
It was a pleasure. Thank you, doctor. Okay, so you heard it from Dr. Nguyen. Be proactive about your own health. Have a conversation. Talk to your partner, talk to your wife, talk to your spouse, talk to your sibling. Open up the conversation. If you are feeling off, signs, symptoms, whatever, who knows, maybe someone you love is experiencing the same and they can give you information that can help you. Remember, the most important conversation you are going to have is about you and your health. Guys, talk about it. Check your ego at the door. Get into a conversation. You got this, I promise you. On behalf of all of us here at Healthline, happy Movember, and you can find us on all types of social media. I'm Gregory Zarian. Be safe, be well, and we will see you next time. Thanks.